Want to give the interpreter one more second or?
We're going. We're live.
Oh.
Hi, everyone. Good to see you. Thanks for joining. We're just having a regular update on COVID-19, and I'm going to have the members of the team share different components of the update with Director Bond, Mike Biscatelli, and then Dr. Jalal. I will hand it over to Director Bond to give a high-level update on health-related topics.
Good afternoon. I hope everyone is staying safe. Today, I just want to talk a little bit about our situational awareness and sort of also address some of the things that we have been doing on our ends from the city side on preparing for mass vaccination. As always, I'd like to make a disclaimer that this presentation is as relevant as of today. Our information continues to evolve and it is very fluid. Can everyone see the slides? I just want to make sure that there's a visual.
Yes.
Okay, great. So I'm going to go over really quickly a situational awareness, our mass vaccination efforts. And so what we are currently monitoring along with the state is where we are statewide, as well as where we are locally. And so currently, as you know, over 97% of the state is in the red alert. On an average, we are seeing about 41 cases per 100,000 in the city of New Haven. So we are certainly closely monitoring and are allowing our COVID response to support the COVID response framework. And so we are definitely doing everything possible to ensure that we are in communications with our different sectors and mitigating and doing preventative messaging for that. One of the other indicators that we continue to monitor as part of our response efforts is we are looking at our county-based indicators and our leading indicators around not just positivity cases, but where we are with the percent of positivity cases, where are we as a hospitalization, and also looking at our flu monitoring. So right now, every single county in the state of Connecticut are in high risk for both those indicators, and we continue to monitor that very closely. The hospitalization is another indicator that we really look closely and monitor. As of yesterday's date, we had 225 COVID in-house patients within the New Haven system. We also had 61 in ICU. Their occupancy rate is currently at 75% and the ventilator usage around 53%. We are proud to be able to work with our local partners as we continue to respond to this pandemic in a collaborative effort. One of the things that we are doing is also really gearing up and working around mass vaccination. I know, and I've been watching a lot of the national studies, local studies, state conversations around mass vaccination. And we know right now that the vaccines help the body produce antibodies to fight the virus. The vaccination will help prevent with the infection of COVID-19, and vaccination may help lessen symptoms of COVID-19 illness if you get COVID-19. We want to make sure that particularly people that are at risk or severe illness of COVID-19 get vaccinated. And we will be working closely with our state partners on the launch and implementation through the different phases that the governor has announced in previous press conferences. We will work with, we know that the vaccine will work with the immune system to clearly fight the virus if exposed. And it's recommended by CDC that a combination of getting vaccinated and following the CDC recommendations on the protective precautions can protect yourself and others and can offer the best protection from COVID. So we know the clinical trials and the authorization and the efficacy rate that are indicated currently are favorable, and we're excited to be able to be partners in this effort to ensure that our community have timely information as well as be able to make decisions on whether they will be able to get vaccinated and when would that happen. So what you see in front of you is sort of a layout of the different phases that was published by the governor's office and announced from the governor's office. Phase 1A is going to be targeting healthcare workers, residents of long-term care facilities, and for medical first responders. There will be a handful of health departments that will be activating in Phase 1A to help support this effort. The City of New Haven Health Department are looking forward to being part of that process. We have officially submitted our mass vaccination plan. We worked really diligently. I want to thank Dr. Vasquez and her team for working diligently, as well as Dr. Dalal on sharing their expertise to making sure that our plan is inclusive and incorporating all of the pieces that need to be incorporated. And then phase 1B and phase 1/2, as you see in front of you, will vary and updates will be forthcoming as we get a better handle on the vaccines that Connecticut will be receiving and to what extent so that we can ensure that we are providing the latest information. So as things continue to evolve, we will make sure that our New Haven residents have the information that is needed. So this is the two vaccines, Pfizer and Moderna, that we have been reviewing and we will be expecting to receive. We know primarily the health department will be administering the Moderna vaccine. If we get doses of Pfizer vaccines, it would be in limited amounts because of the monitoring of the temperatures and making sure that the shelf life as well as the appropriateness of temperatures are maintained. And so we will be working closely with the Department of Public Health and ensuring that. And what you see in front of you is a graph that will be shared on the efficacy rate on the different vaccine trials that have been underway and those that will be um, launched and approved through the emergency authorization. And right now, Pfizer and Moderna have met that criteria. We should hear about Moderna sometime next week. And so we're really looking forward to getting further information and reports so that we can share that with the public. These are just an example of the Pfizer vaccine and where we are in regards to the findings. And so we know that Pfizer is 95% effective. The efficacy after the first dose was 88.9 and 95% after the second dose. The most common side effects include pain and redness at the injection site. You may experience fatigue or a slight headache, muscle pain, chills, and joint pain and fever. And so we will be closely monitoring that and supporting our residents that get those vaccines, similar to other vaccines that have been already approved for many years. Trials included individuals of all races and demographic makeup, as well as ethnic groups. And the safety data milestone required by USDA, the FDA were achieved. And so we were happy to see that the preliminary reports are favorable and that the vaccine will be safe for our residents. Moderna is similarly to the Pfizer vaccine, except that the Moderna is shelf life is 30 days. It can be refrigerated. So they're just different places of where they can be refrigerated. One needs to be frozen, not one needs to be refrigerated. And the interim results as well are yielding that there were over 30,000 volunteers, observed 95 cases of symptomatic COVID-19, only 5 of which were affected participants who received the vaccine. There were no significant safety concerns observed during the trial, which is good news. And there were some severe events that occurred in greater than 2% of the patients, included just the fatigue, muscle pain, headache, and achiness. And they were generally short-lived. And so about 37 of the volunteers of 30,000 were people of color. And so what I want to do is, as I close, again, New Haven Health Department will be providing support to first responders, healthcare workers, and high-risk populations that will if they wish to get vaccinated. So we are looking forward to making announcements as the vaccines get shipped and available with our clinic times where we'll be doing the vaccination. As always, we ask individuals to please visit our COVID COVID-19 hub page, where we try to have the latest information available to you. All of our resources, our testing sites, our flu vaccines are all found on our City of New Haven webpage. And so with that, I will be remiss if I don't remind everyone to please participate with the COVID Alert Connecticut app. You can activate and be able to indicate whether you are positive, and be able to tell if someone close in proximity is also positive. So we invite you to visit and watch this short video on learning more about how the COVID alert can save a life. And so with that, I just want to indicate to continue to increase awareness within your community and your networks. We want to assist in engaging local businesses and other sectors on what's coming and staying protected, and promote and coordinate testing sites in your community. So please stay in touch and let us know. And most importantly, during this holiday season, we ask you to stay safe. So with that, I'll turn it back over to want to turn it over to Dr. Vasquez to share a little bit about our efforts and how you can engage in supporting mass vaccination.
Great, thank you, Director Bond. So as Director Bond mentioned, we're very excited about the mass vaccination efforts we will be working on in the coming weeks. And there is opportunity for the community to help support these efforts through our Medical Reserve Corps. Individuals can sign up for our Medical Reserve Corps at CT Responds online. And we are recruiting for both medical and non-medical volunteers to assist with the efforts. So that includes medical volunteers who are licensed, who can help actually administer the vaccine, and non-medical volunteers who can help with other aspects of the vaccination effort. Thank you.
Thanks, Dr. Vasquez. I know that Mike Biscatelli is a little bit short on time today. I'm going to hand it over to Mike to talk about some of the work that we're doing to support the business community.
Thank you, Mayor. Thanks, everyone. Nice to see all of you. As you
Thanks,
heard from
Mike. And you're a little bit quiet. Your volume's a little bit quiet.
Can you hear me better now?
A little bit.
Okay, sorry for the technical challenge there. Just wanted to thank everyone for the support. What Director Bond had mentioned in the vaccination, sort of the introductory understanding of the various vaccines, we've been doing the same with our business community partners to build market confidence in the vaccine. I think we're more and more of the understanding that it'll be a very long road between now and say mid-June of next year, and that means 3 to 4 months of very down times, particularly in the restaurant industry. You're hearing that across the board. And if you heard that on the Chamber's regional outlook yesterday as well. So we got a couple of things that are coming up next week to help support. On the technical assistance side, we have a webinar specific to restaurants that's coming up on December 17th at 2 o'clock. That will help to expand the reach of any individual restaurant's known customer base through either social media, through direct advertising. We're also going to be working with the hotels on the 17th at 3. We'll be doing a canvas in Hill North on Monday of next week. And then we'll be rolling out some additional and supplemental marketing programs that are geared specifically to support restaurants during this time. That complements the existing Passport program. Talked about the Passport program in previous press events and on the media generally. That runs through December 20th. As you recall, with the Passport program, you get 3 or 4 stamps, send it in, and then the prize packages are worth $950 each. So it's a great way to support many of our downtown and near downtown businesses through the Passport program. Finally, on funding, just a reporting out on some of our programs. We've now approved 7 loans through the Partnership Loan Program. That's focused on Black and Brown communities. It's the partnership we launched with the Community Foundation and the More Proper Fund. Those first 7 out the door are valued at $149,000. And then we have another pending in the pipeline that are likely to be improved, all related to New Haven-based businesses. The Yale Fund is still available, and I'm sure you're following the national news as we are. Very hopeful to see the next round of PPP, which is a very important and structured support for many of the businesses, the storefront businesses that will need some help to get through the winter. Happy to answer any questions on those.
Thanks, Mike. I know this is a little bit atypical for our press conferences because Dr. Lal has some updates and I have a quick thing to say as well. But since Mike has to leave early, are there any specific business-related questions for Mike before he leaves? I see Tom, raise your hand. Go ahead.
Thank you, Mayor. Thank you, Mike. Mike, you mentioned at the top of your presentation the city's interest in helping build market confidence in the vaccine among the city's business community. Could you explain a bit more about what building market confidence around the vaccine in particular means and what the city is doing around that?
So we started with a conversation with Usha Palal, who's our sector specialist in the biosciences, to understand the science. So what are those anxieties that we've heard, with the vaccine itself? It's happens quick, the emergency authorization, all the things related to, the speed with which it's, so important to address the pandemic now. And what we've learned by sitting with Yale Public Health and with our sector specialists is the science behind how the vaccines were developed and how they'll be rolled out. Director Bond touched on that. And the more everyone learns more about that backup in the science, much of which was developed right here in Connecticut, it helps build the market confidence for our business owners to talk to their employees, talk to their families, and build that confidence to take the vaccine.
Any other questions for Mike before he takes off? Thanks, Mike. Appreciate you joining.
Okay. Thank you all. Have a very nice weekend.
Yep. Dr. Dalal.
Hi, good afternoon, everyone. I have a short update related to how we're taking care of the homeless population over the winter. Last weekend, as you know, was some bad weather, so we actually accelerated the launch of our cold weather protocol and added 120 additional beds, rapidly over that time. And it was a good thing that we did. Those beds filled up pretty quickly with respect to getting folks off the streets and in a safe environment. Those 120 spaces are on top of the 200 spaces that we would typically have during a normal sheltering, quote unquote, normal sheltering year. So we think we have a good, adequate number of spaces, but we are working with our regional partners, the Coordinated Access Network, as well as the Department of Housing and our local service providers to monitor the situation and to understand if we need additional beds to meet the demand. We know somewhat, this is sort of an evolving issue as we kind of monitor what goes on with, potentially people newly becoming homeless or people migrating in and out of New Haven. So we are actively monitoring it right now. We do feel that we have sufficient number of beds. I also want to take a moment to acknowledge some of the, the local service partners that have really been the front end and frontline providers here that often don't get acknowledgement. We've been working very closely with Emergency Shelter Management Solutions, ESMS. They typically operate the Grand Avenue shelter, but as I've announced on these calls before, that shelter as a congregate space is not open because it's not safe to do so. But they've been really on the front lines helping with some of the cold weather protocols that we implemented quickly last week. Columbus House is also a partner in this as well. With respect to families, we have separate organizations that specialize in serving families. As they would be with any other quote unquote normal year, they're also providing services. That's New Reach and Christian Community Action. We have additional partners that a long list of partners that be too much to manage to list out on this call, but we have partners that provide case management services, diversion services to make sure that those who are homeless have access to the best possible option for them. And I do want to emphasize that, because it's very important to systemize the services, that anyone who wants to, get registered into the system should go through the 211 system. So if anyone is homeless or you're a provider and encounter someone who's homeless, their first step is to call 211 and get registered in the system. That is the pathway by which we can get them hooked up to the appropriate services. So I think that's my brief update. Thanks.
Thanks, Dr. Dalal. I wanted to just finish up before we open up to questions by talking about a trend that we've been seeing. To date, since the start of the pandemic, we've seen 5,857 cases in New Haven and 129 fatalities related to the virus. But we're seeing a trend in recent weeks where there's a larger percentage in the Latinx population that is COVID positive. In particular, we've seen a hotspot in Fairhaven. And while we're still trying to push for the testing partners to identify race and ethnicity for people that get tested so that we can get better data, we are seeing that the Latinx population is a larger percentage in general of the individuals that are testing positive. This is for the last 2 weeks, this data that you're seeing in front of you. Our team is working to do more outreach, particularly Spanish language outreach, to ensure that we're encouraging the Latinx community to be reminded, as everyone should, about the social distancing guidelines, to make sure not to gather in groups of people other than our a core household group, and to wear masks. And that's been everything from Spanish language interviews to we're working to reach out to groups that work at the grassroots level with the Latinx community. But I just wanted to make the press aware of that particular trend that's been going on now. One final reminder, we're in the holiday season, and it's, as always, I think this message has gone out over and over and over again. Please, please, please do not gather with people that are outside of your core group. If there is an absolute need to do so outside, and always do so masked. Any questions? Go ahead, Tom, and then I'll go to Sharon.
Thank you very much. Maybe I'll go through a few and then cede the floor, and then maybe if I could be returned to, that'd be great. For Dr. Jalal, first, where are these 120 new beds that recently came online, and where are the 200 others that you said are more regularly available in other years?
Yeah, so we are not doing congregate sheltering in any capacity right now. So these are all small rooms, individualized rooms at various hotels.
Are they all the hotels all in New Haven, or are they throughout the area?
We're taking a regional approach through the CAN system, as is the rest of the state, right? So we're sort of in parallel with the rest of the state and all their CANs, and they've done similarly.
And roughly how many of those hotel beds, those 320, are currently occupied?
It's not quite at capacity, but we're getting close. My understanding, because the cold weather protocol allows for some churn, so like the day-to-day numbers change. But I think they're you could say about 60 to 70% full at this point.
Thank you. And for Dr. Vasquez, got a few questions about the mass vaccination plan, and for Director Bond as well. Maybe first for Dr. Vasquez, can you tell a bit more about, if people do sign up for the Medical Reserve Corps, you said you're looking for people with medical training and without medical training. Could you give a few more examples of what people might be what they might do if they sign up, and if they fall into either of those buckets, what would they be volunteering for?
Absolutely. So for medical volunteers, we could have volunteers help with screening patients for contraindications, making sure they are safe to receive the vaccine. As mentioned, they can help to administer the vaccine and help with the medical aspect in that regard. Non-medical volunteers can help with registration, either online in advance of clinics or day of. Also help with crowd control, setup of the clinics, and tasks in that manner.
And then my last question for now also gets at a bit more. So it sounds like the city would be involved in actually administering vaccines once they become available, if I'm hearing that correctly. So where would that happen, and how are you all envisioning doing that?
So there's a couple of options that we have. Our plan consists of a number of ways to execute. We will be providing vaccines right at our 54 Meadow Street, where our clinic site is. It's led by Dr. Vasquez, so we have a clinic site. And we also have the ability to create sort of like the pop-up testing method. We will do pop-up testing sites where in the emergency preparedness world, we will call it strike teams. So we will incorporate strike teams, and my cape will come on and we will go and give out vaccines. Sorry, it's an internal joke.
Maybe that's it for now, but I'd love to have another
Sure.
shot.
Thanks, Tom. Sharon.
Hello, everyone. Two non-COVID related questions for you, Mayor Elicker. Number one, what are your thoughts on the revamped Police Civilian Review Board, specifically the changes they made with giving them the addition of subpoena power?
Sure, this is a good question. This has been a conversation that's been ongoing in New Haven for many, many years now. And I've been a strong supporter in the past and still am about the Civilian Review Board having subpoena power. I think the primary reason for that is that without subpoena power, the Civilian Review Board doesn't have as much of a significant role in oversight over potential police misconduct issues. So I think it's a good thing that the Civilian Review Board does have subpoena power. It's also a good step that the state of Connecticut brought further clarity, because last year when the Board of Alders approved the Civilian Review Board having subpoena power, there was more ambiguity at the state level that could have opened up the city to potential problems because of that ambiguity. But now it's more clarified at the state level, which just provides a clearer path for the Civilian Review Board's exercise of its oversight.
And then one more question, obviously the police department has had a very difficult year with everything going on with COVID, with violence on the rise, but also looking back to 6 months ago when we were going through the Black Lives Matter protest, George Floyd was killed. What progress do you think the city has made, or lack of progress, as far as, mending those relationships with Black and brown people?
I think that there's a number of ways that we've worked to improve public safety in the city, which I think a lot of the conversations around defunding the police ultimately are based in a conversation about how do we keep our community safe, and oftentimes policing isn't always the best answer for that. And so there's been a lot of communication. I know the chief has had a lot of meetings and conversations with individuals involved in the protest, as have I. But I think one of the things that I'm most proud of is the work that our team is doing to create a crisis response team. Dr. Jalal and his team in particular spent a lot of effort and thought into crafting how that will look. Community engagement with many of the stakeholders. And we want to do this right. And so we don't want to do it haphazard or quickly. And so Dr. Jalal and his team have been very deliberate in creating a crisis response team plan that will allow us to respond to public safety issues that may not necessarily require a police officer. And in fact, the response of a police officer could potentially escalate an issue. I don't know if Dr. Jalal, you have anything to add there on the progress that you've made.
Yeah, sure. No, I appreciate the comments, Mayor. Yeah, so we did a substantial amount of exploratory planning around what the exact, what type of model would work for New Haven. And what we understood is that we need a formal planning process to understand what model would work for New Haven. In terms of, kind of concrete progress, we do have a request for proposals out there to identify a contractor that with experience in mobile crisis services, that can indeed help plan through the very important details of this proposal, including a structured framework for community input from Black and brown communities.
And is there any idea on when the crisis response team will come to fruition, or you guys are still just going through the plan right now, seeking out contractors?
Yeah, I mean, we've set a target to deploy a pilot team by the fall of 2021. That's of course contingent on funding being available. But that is our hope.
Thank you, guys. I appreciate it.
Thank you, Sharon. Let's go to Brian.
Thank you. I'm curious to know if the city has any early information or feedback about whether there needs to be any work around convincing people to get vaccinated. We know that medical racism means that sometimes there's different work that needs to be done in different communities to convince people. I'm just not sure if there's any feedback or efforts to do that.
Yeah, absolutely. So we created a risk communications team that encompasses a number of stakeholders, including also partnering with the Young Haven system so that all of our messaging is going to be consistent and from a trusted source. And we will be testing our messaging as well with key communities to ensure that our testing messages are not biased, but are culturally and linguistic appropriately as well. And so certainly we think about that. We talk about that often. And so we wanted to make sure that our mass vaccination plan has a risk communication plan that's robust and inclusive of everyone that can lend input and be able to ensure that everything we launch within the different phases for the different target audiences that we will be vaccinating will have the most trusted information that's available so that individuals can make the best decision for themselves.
Thank you. I'm also curious if the health department has reviewed in any way whether the public health data is good enough to maybe reopen schools. Is there any consideration for that?
Yeah, so we are continuously assessing data and metrics, both the primary, secondary indicators that I presented earlier. We certainly want our schools to reopen. And so we are convening weekly and sometimes twice a week on the readiness and preparing for that in the near future. So stay tuned. I don't know if the mayor wants to add anything that I just indicated.
Yeah, I think that what we're seeing just broadly across the U.S. and in Europe is that a lot of the data indicates that younger students, younger individuals, the virus is not significantly spreading in that cohort. And that in general, for younger ages, school is a relatively lower risk environment. And so I think that if we did end up moving forward with an opening, that's an area that probably has the most potential to start in a safe way. I hear from parents on a very consistent basis, including my own wife, about the strain that it puts on people's home life to continue with remote learning. I did want to take a moment. I think we should give a shout out to the teachers who have been doing an incredible job on remote learning. Having been a teacher before, I can't imagine trying to manage a classroom over Zoom. And I am often, when my daughter starts school in the morning, kind of listening on the side, and my daughter's two teachers are just inspiring in how they can work with her and the other students to keep kids on track and bring joy to a classroom, even though the classroom is at many points all over the city and on Zoom at the same time. I mean, just to watch her standing in front of a computer and doing phys ed and bouncing up and down and stretching and doing yoga. I mean, the work that the teacher's done is amazing. Nevertheless, it's obviously clear that in-classroom learning is what we all need, and we'll be working to get to that point as soon as we can. Brian, you good? Can we go to Kyle?
Good, thank you.
Okay.
Hi, everyone. Mr. Mayor, I just wanted to ask you to that point about teachers. a lot of the things that we've covered in the other districts have not been transmission necessarily among students in the younger schools, but has been that teachers have had to quarantine for 14 days. CDC has kind of relaxed those quarantine times at this point, but would you all consider in New Haven having teachers included in that first responders first round so that schools can get back to being open?
This is a great question. It's ultimately not our choice, but we've talked about how important it is to have teachers very early on in the group that gets vaccinated, ideally in the kind of second tranche of critical workers. And I plan on encouraging the governor's office to prioritize that. And correct me, Dr. Vasquez or Director Bond on this, but we've generally seen a similar trend when we were partially opening up schools where the teachers were most often the ones that were ending up coming into school with COVID, and the vast majority, if not all, again, Dr. Vasquez, feel free to weigh in here, were contracted outside of the schools. And so I think that, it's very important for us to continue to work with our staff and teachers to make sure that they're very cautious in their personal lives so they don't bring it into school. But the indications are at the younger ages that school is not the place where most of the contagion happens. Dr. Vasquez, did I say anything wrong there?
Nope, absolutely right, Mayor.
Okay.
And then I had one other question regarding Fairhaven. It's been a hotspot since the beginning. And I know you guys have reported out on all of your efforts to communicate with Fairhaven. What do you think the challenges are there? Is it cultural, or what do you attribute the challenges are for Fairhaven?
So,
go ahead. You take it first.
First out. So, throughout the pandemic, we've seen hotspots in different areas. It hasn't been consistently just Fairhaven, but as of late, we have seen a high density in Fairhaven. And, we've done a lot around education, education of small businesses, education around with faith leaders. And what we're finding in our contact tracing efforts that across the board, regardless of race and ethnic backgrounds, that social gathering continues to be a major issue, especially in my culture, being a Latinx community member myself. It's been really hard not to be able to socialize outside of my household. Our culture really believes in family units, our external family members, even our neighbors become an extension of the family. And so, it's really important that, we continue to work with community leaders and influencers to help with messaging, because it is a culture shift and frankly a shock for many. And also there was a lot of miscommunication coming at the federal level, where it also caused some confusion about the pandemic, and the pandemic being tied to politics. And there is no politics in this pandemic. This pandemic is real. It's not a hoax, and is impacting the Latinx community at such a greater rate. And so we want to make sure that we invest the time and continue to do so, because we've invested a lot of time. We're now working with partners such as SAMA, which is Spanish Associations of Merchants, to help us with education as well for businesses, because we want them to stay open, and now engaging community leaders that are very influencers to now help us with increasing and expanding that effort so we can mitigate the cases as much as possible.
Thanks, Director Bond. I would just add that Fairhaven in the first surge was also a hotspot, but a lot of that was driven by Mary Wade Home, which is located in Fairhaven and had a very significant outbreak.
And one last question, if I may. Does New Haven know how many vaccines that you guys will be getting? And as far as storage, with the ultra cold storage, if Pfizer does get approved, are you guys working with Yale for storage, or is the city separately storing their own? How's that working?
That's actually a really good question. So we do not know how many vaccines we will be getting as far as local health. We know that Connecticut as a whole for the first wave of distribution will be getting 31,200 with the Pfizer vaccine. Shall we get the some of the Pfizer vaccines? The shelf life is can be stored in dry ice for 5 days. We know that the ultra cold freezers are housed at the hospitals, and so they will be having the majority of those. But if we were to provide some aid or support, we know that we will be able to have a shelf life for up to 5 days with the dry ice. And so our main distribution will be the Moderna vaccine. And so we continue to work with our partners at the state so that we can get better guidance on exactly what's going to be executed. And we'll definitely have an update in the next few days, which honestly by Wednesday we will have a better picture exactly of how the execution is going to happen.
Cool. Thank you.
You're welcome.
Any other questions?
Hi, Mayor. This is Dave Altamari from The Current.
Hey, Dave.
A couple of vaccine questions, if I could. Maritza, do you have any sense whether healthcare workers and nursing home workers are actually going to get the vaccine, are going to take the vaccine? I don't know if you've had any conversations. I've talked to some providers, nursing home providers, who are concerned that workers aren't going to take the vaccine.
You know, I think that concern is in almost every sector within the first wave. Myself and the mayor, we've all had conversations with different leaders. We certainly are not going to mandate the vaccine. What we've done on our end, with our first responders, for example, we conducted a survey. So what I would recommend is to really get a clear picture of the employees that are willing to do so, if conduct an internal anonymous vaccine survey so that healthcare entities and home long-term care facilities can then plan accordingly and be able to know exactly engage what is the actual numbers, because there's certainly perceptions and conversations happening, but really there needs to be some actual survey analysis being conducted of what workforce are anticipated to get that vaccine.
If I could just add, so we've had a lot of conversations both internally and with partners about whether people fear around the vaccine is going to be a major issue, and we're concerned about it. Generally, the surveys that I've seen come out at the national level are I think better than I would have thought, given the amount of disinformation and mistrust of government that has been promoted, particularly at the national level. I think that in my conversations, most of us are seeing that over time, there's enough people now that are very open and interested and willing to get the vaccine, that over time, more and more people will get the vaccine, and that will increase the comfort level of those individuals that still feel some understandable apprehension, right? And also there hasn't been an incredible amount of effort to publicize the data on how vaccines in general are vetted, which is some of the work that Mike Piscatelli referenced earlier on. And I think our team will be doing that with our partners at for example, School of Public Health, just so that the public has more information to feel more comfort. I'm cautiously optimistic that that many more people than we think, or that this will be easier than we think.
Yeah. I just want to add, because when we're talking about being optimistic. So earlier this week, the mayor and I went to Fairhaven to support a flu clinic. And Gage and I were walking around trying to recruit individuals to come over to the flu clinic vaccine mobile van. And, I'm bilingual, so I have the opportunity to engage in Spanish with most of the community members. And there were a large group of people out, believe it or not. And as we were having and convening a conversation, everyone was excited, thinking it was the COVID-19 vaccine and were willing to get the vaccine. So that gave me a glimpse of hope within the Latinx community that I was raised in, that, that they're open and ready to get the vaccine when it becomes available. So that gave me a great deal of optimism when I left that community. So although we didn't get to vaccinate them with the flu, because some of them already had it, and but they really were eager, thinking that was the COVID-19 vaccine. So that to me gave me a good sense that that community members are ready for this.
Anything else?
As a follow-up, Maritza, I'm assuming you're talking about vaccinations in the 1B category, that you're gonna be involved in some of those. That's a pretty big group, obviously, that hasn't quite been nailed down yet, but is that when you anticipate that you'll be starting to putting some shots in arms?
So we will be hopefully supporting actually in 1A. So there will be a number of us health departments in the city of New Haven, I mean, across Connecticut, that will be supporting at some level in activating in 1A, and where the rest of health departments will be activating in 1B. And to your point, 1B has not been finalized just yet. The local health department, as I indicated earlier in my little slide, Decker, we will, and Dr. Vasquez's team and MRC volunteers will be supporting first responders and some healthcare workers that want to opt out of the healthcare and be able to have access at the health department at the city of New Haven.
And how about like your health department people, and where are you in the chain to get? I mean, you have to get vaccinated in 1A, correct?
So those of us that will be involved in the direct mass vaccination, including the volunteers, will be offered the vaccine as well.
At Yale, or by you, or by
By our team. So we will get the delivery and then we will vaccinate. And we will obviously stagger because we want to make sure we are able to still execute the vaccine distribution that we need to do.
Thank you.
You're welcome.
Any other questions? Go ahead, Tom.
I'll be quick. Thank you so much. A few more vaccine related questions. So when did the city submit its mass vaccination plan, and to what? Was it to the State Department of Public Health, or where did that go?
Correct. So we worked diligently on the plan. We received input. We had a whole mass vaccination committee where we wanted to make sure we had an input from designated stakeholders that will be involved in the process. We allowed our Board of Health members to review the plan. As you know, we have physicians that sit on our Board of Health Commission, as well as the administration, to allow the administration to also provide input. And then we submitted officially our plan to the State Department of Public Health on December 3rd. Well before the deadline.
And is that publicly available? Can you share that with us in the press?
Yes, I certainly can do that.
Thank you. And in the plan, do you require, I know someone earlier asked about how many dosages we expect to get, but did you request a certain number? Like, how many would you like the city of New Haven to receive, and by when?
The preliminary conversations that we're having with the state is about averaging 100 doses a day. That has not been confirmed because we're still waiting to see the level of shipment that we will get. But we have made a commitment that we can do 100 a day.
And are you requesting only Moderna, at least among these first two, or will the city health department also request Pfizer, even taking into understanding the refrigeration concerns?
Yeah, so as indicated with the shelf life, as long as we are able to adhere to the shelf life for Pfizer, we will accept Pfizer vaccines. However, we will primarily be given Moderna vaccine. And by we, I mean the health department.
And my last question is, when is the earliest that you would hope to get vaccines?
Within the next few weeks, we are anticipating to roll out the plan.
Thank you so much.
Anything else? All right, thanks everybody. Good to see you.
Stay safe.